presentation I'm going to talk about exercises for special populations. So the first is a client that has high blood pressure or hypertension. So high blood pressure within the heart is possibly caused from excessive fat and sodium buildup in the blood vessels. So in terms of resistance training for clients with hypertension, it's really important for them to keep their head above their heart. They need to perform the exercises in a rhythmical fashion, and it should be slow and controlled through a full range of motion. Heavy weightlifting should be avoided, as this could increase their blood pressure. In terms of cardio training for clients with hypertension, depending on the grade of the hypertension, cardiovascular training should be performed 3 to 5 times per week, and it's recommended to commence their training at around 40 to 60% of heart rate max and increasing from there. And in terms of the duration of the training, it should be for 30 minutes or more. So for clients that have a lower back injury, strength exercises that use back muscles as the primary mover, such as deadlift, should be avoided. A client with lower back pain should be prescribed exercises that strengthen the core, and the focus should be on stretching the back to increase mobility. So for an alternative exercise to the deadlift, I would suggest the client does glute bridges. It's a good alternative as it works the glutes, hamstrings and abs, and it caters for the client's injury by making sure the glutes and abs muscles are strong and strengthened. The next is a client suffering from knee injuries. They may not be able to participate in some exercises that are load bearing on the knees, which includes your lunges or squats. So for an alternative exercises to the lunge, I would also recommend that the client does glute bridges. The glute bridges target the glutes, hamstrings and abs and places minimal pressure on the knees and the hips. Another good exercise is the quadruped triangle, which is good for glutes and thighs, again with minimal impact to the knees. In terms of, I know I said before that lunges and squats can be avoided. There's also modifications that can be done to lunges and squats, such as